Okay, it is 10 on the nose. We're going to go ahead and get started. First and foremost, thank you so much for taking time out to spend with us today and learn about how you can access your care with your PECP or your specialist. And joining me today is Michelle Lahuda. She is our Government Programs Director. Michelle will be leading us through our presentation. Michelle?
Thank you, Denise, and good morning, everyone. Happy Groundhog Day. I heard that the groundhog said we have 6 more weeks of winter, but that will take us right up to spring anyway, which is March 20th, so that doesn't seem like it's too bad of a thing. So let's get talking here about our accessing primary care, specialty care, and urgent care. So everyone by now should have received their WHA ID card, and if you have not received your member ID card, please let us know. Your ID card is important because it lets your doctors know that you are a WHA member, and they use that card to confirm your eligibility for services. For your convenience, we've included your primary care doctor's name and phone number on the card. And on the back of the card, it also includes important phone numbers, for example, Western Health Member Services Department, the phone number for Magellan Behavioral Health, which is the mental and substance health network that our members utilize. And if ever any time you need to change your primary care physician, we will definitely issue you a new ID card with that doctor's name and phone number on it as well. So it's really important that you establish yourself with your primary care physician, especially if you are a new member seeing a WHA doctor for the first time. Now, a PCP can be a family practice doctor, an internal medicine doctor, or a general practice doctor. If you're an existing patient of a WHA doctor and a new member of WHA, you are already considered an established patient. So the next time you visit your doctor, you just need to let them know that you are now a WHA member and present your card. Your primary care physician's role is important because it coordinates all of your healthcare needs by either direct treatment or referral to a specialist. So you do have some options about how you receive your care, especially in our environment that we've been in going on for almost a year now with stay-at-home orders. So you do have the option to still continue to have in-person office visits with your doctor, or you can also elect telehealth. It's important to know your copay for your office visit or for the telehealth visit is the same. So you're not disincentivized to contact your doctor by video chat or by phone, because it's very important that you receive your care, so you're never going to pay more for those telehealth visits. Now, your doctor's office will let you know when those options are available to you, because depending on the type of care you're receiving, it may be more medically appropriate for you to go into the office versus having a video chat. You need to have those discussions with your doctor. So speaking of telehealth, there are some benefits to having a telehealth visit. You can sometimes get a more flexible appointment time depending on your schedule, and that can lead to quicker access to a provider when you have the ability to be flexible. You do have the savings of a Linnea commute. I know where I go to see my doctor, I do have to pay for parking because I go downtown. And like in-person visits, your telehealth visits are completely confidential. And then again, as I just said, the copayment is the same for both types of visits. So you've seen your primary care, and maybe you have a reason now to see a specialist. So your primary care doctor will be able to give you that referral to seek out that specialty care, and you can get a referral within your same medical group. So if you belong to Dignity Health or St. Joseph's, they can refer you to a specialist within your medical group. You also have the option to take advantage of our Advantage Referral Program. So what that is, it allows WHA members to seek specialty care outside of your assigned medical group with another WHA participating medical group. So for example, if I am a member of Hill Physicians and I have a cardiac scare, for example, and I know of a cardiologist at Mercy that I would like to get my specialty care from for that cardiac scare. I can ask my primary care doctor to refer me to that Dignity Mercy. Sorry, I still use them interchangeably. I'm such an old Sacramentan. So to go to see that cardiologist at Dignity, even though I'm in Hill. So there are some limitations in that you need to have a medical reason to seek specialty care, and you need to be the person to initiate that request. So now if you have a condition that requires ongoing specialty care, your primary care doctor can write you a standing referral. So you don't have to keep going back to see your primary care doctor every time you need to see that specialist. I'll use myself as an example. I have a reason to see a rheumatologist. So my primary care doctor wrote the referral, and it's valid. It's a standing referral, valid for the year, to cover all of my quarterly rheumatoid appointments. So I just want you to understand that you don't have to go back every time to get that referral from your primary care doctor. You don't even have to call. Now, if it expires, sometimes you might have to make that call at the end of the year to say, or when you see your doctor for your routine physical. Remember, I have this renew my specialty referral, and oftentimes, though, doctors will go ahead and do it because they just know. But that's why that relationship with your primary care is so important to have that established. There are some services where you don't have to get a PCP referral. So, for example, an urgent or emergency care situation, that doesn't require a specialty referral to access those services. And if you have a need to call your doctor on the weekend and you get the on-call doctor, that's, you don't need a referral for that. And to see a gynecologist, you don't need a referral for that. You just need to stay within network. So you can go see a gynecologist at Hill, Dignity, and then for annual eye exams, same thing. You don't need a primary care referral. And if those of you who joined us in the last couple of weeks also know that to seek behavioral health services through Magellan or chiropractic and acupuncture services through Landmark, those two services also don't require a referral from your primary care physician. You have direct access. Okay, let's talk about urgent care. So I've always gone by the philosophy that if I have reason to think about what type of care I should get when I'm having an emergent situation, so if I have time to think about, where should I go, what should I do, I've learned that means I have time to make the phone call to my doctor when I'm in area. So I would suggest when you have an urgent situation that you call your primary care doctor's office to seek direction for the type of care you should get. And it doesn't matter about the time of day or if it's the weekend. I mean, that's our doctor's role, is there to take care of us. The reason this is important, because sometimes we may think we just need to see urgent care, but the doctor, depending on the information you share with your provider, may actually send you to the emergency room. So again, if you have time to think about what type of care you should access, go ahead and make that phone call. So what are the types of issues that you should go to the urgent care for? When you're making a dinner and you cut your finger and obviously you need some stitches, that's when you're going to want to go to urgent care. A sinus infection, that's a great one to go to urgent care for. Pink eye, a rash, those kind of problems are best handled at urgent care because you really don't want to be sitting in an emergency room for a sinus infection because you're going to get bumped to the end of the line every time for more emergent situations. So new this year, we are excited to bring Teladoc to our membership for urgent care virtual visits. So it's 3 o'clock in the morning and you're feeling like you have an urgent situation. You can use Teladoc to reach out to a doctor and phone calls, video, and they can help you diagnose your situation. And again, they could also, if need be, tell you to go to the emergency room. So it's just a really good option to have. And the best thing about it is you can often get this result, have your conversation and your diagnosis and treatment within 10 to 15 minutes without leaving home. And it's really great too for when you're traveling. And Teladoc, also similar to the urgent care center, is great for minor injuries and illnesses such as the cold, the flu, muscle sprains, upset stomachs, that type of thing. And the copayment is the same as urgent care. Now, thanks, Steve. So another option that we have is WHA's Nurse 24 program. So you can connect with a registered nurse via phone or chat, and they can help answer similar questions. For example, what type of care should I be seeking? Should I be going to the emergency room? Can I wait till tomorrow morning to see my primary care physician? What are some home remedies that you can suggest that I try? So Nurse 24, as the name applies, is available 24/7. So don't hesitate to call. And they can also, if some folks might be in need of WHA's disease management programs, they can help with that too. So a little more serious type of care is the emergency room care. Of course, if you are experiencing a life-threatening emergency or condition, please just call 911 and get to the nearest hospital emergency room so you can be seen timely and have your care addressed. And this is in or outside of the Western Health Service area. So if you are seeing your grandchildren in Southern California and you're having a life-threatening emergency, call 911, get to the nearest facility wherever you're at, and just let us know, WJ know, within 24 hours that you had this emergency, especially if you're admitted to the hospital, because we don't want, we're going to cover your emergency minus any applicable co-payments that you have for emergency care, but we'd like to know where you are on an inpatient basis, especially, so we can also help manage your care and make sure you're receiving the high quality of care that our WHA members have come to expect. Now, of course, if you can't make that phone call, someone, maybe your loved one, can do that for you. And I can also, I'm pretty confident, tell you that they will ask you for your insurance card, and they will call us to the hospital though. So why would you go to the emergency room? These are very serious, as you can tell. You think you're having a heart attack, you fell and hit your head and you're having severe trauma, chest pains, broken bones, and the difficult breathing. So that some of these are just very obvious. Get to the emergency room or call 911. So for follow-up care after an emergency room visit is not considered an emergency at that time because you've had your emergency event, you received care, you're stable, and they send you home. So, but they tell you at the emergency room, these are the things you need to do for follow-up. For that follow-up care, please do not go back to the emergency room. You need to contact your primary care doctor, let them know about your event and the recommended steps so they can see you right away, and then they can start managing and coordinating your care to make sure all of those items that you needed will be taken care of. So if you do go back to the emergency room for follow-up care, you may be liable for the cost. That's another important reason why you should call your primary care if you have an emergency room event. Okay, so how do you find all these doctors? How do you find primary care doctors and specialists? If you aren't familiar already with WHA's provider search tool, it is on our website. You can get there through the mylaw.org, which is our member portal. or you can access it as a guest as well, even if you don't have a MyWa account. So you can find those family practice, internal medicine, general practice doctors, for all of our medical groups, and all the specialists aligned with each medical group. You can customize your search. If you're looking for someone you know the doctor's name, you can search just by that doctor's name. If you want to see all of the women physicians, the women primary care doctors at Hill Physicians, you can do that narrow of a search, as well as if you have a specific language that you're looking for. And then you can search the distance if you are looking to have someone closer to home. I want to find all of the primary care doctors within 10-mile radius of my home. And then also, it's important, if you are selecting a primary care physician, making a change or selecting a doctor for the first time, you want to make sure that they're accepting new patients. Now, if you are, again, a existing patient of a WHA provider and new to WHA, and that doctor's close to new patient, you're considered an existing patient. So that's real important to remember.
Michelle, can I add something here real quick?
Sure.
Under the facilities, so I've had this question quite a few times, actually. Somebody was looking for a specific pharmacy, not one of the big brand name pharmacies like CVS, Walgreens, but their local pharmacy. In the provider search, if you simply click on facilities, and there's a drop-down box to choose pharmacies, and you can put in your zip code and find the pharmacies in your local area. So thank you for letting me chime in.
Oh, sure. Okay. I'm so focused on doctors, I forgot that. Our website, I can mention that our website, you can search on pharmacy, you can search on hospitals, you can search on urgent care facilities. So it's more robust than the doctors alone. And I keep harping on this for every Tuesday and Thursday for all of January. So for those of you who have heard this more than once, I really hope you would have an opportunity to create a MyWa account. This is access to WHA's member portal, where you can find all of your benefit information, a lot of the information that we talked about in the Let's Talk webinars. This is a great resource for you, and so we really encourage you to take advantage of it. It doesn't take much to open an account. You don't even need your member ID to do so. So Denise, that wraps up my portion. I'm happy to address any questions, or if you have anything else to add.
No, thank you very much, Michelle. We do have quite a few questions, so stay on the line. Let's see. Okay. Let's try to get to all of them. So one of our questions, do you need a referral for a mammogram? I don't believe so, but I wanted to refer that. Actually, that's a great question. So,
and so when your primary care doctor says, "Hey, it's that time of year for your mammogram," if it's they will give you the slip, and it gives you locations to go for that mammogram within your medical group, and you pick the location that's most convenient for you, and you call and you make the appointment. And then the beauty of it is, once you have that initial mammogram with your initiated by your primary care doctor, your medical group should just send you a letter reminding you, "Hey, every year it's time for that appointment. Please call and schedule." So that works out really well.
Great, thank you. Okay, so now we also have one. Let's see. What is the nurse line phone number, or the Nurse 24 phone number?
Okay. 877-793-3655.
And I just typed that in the chat box for everyone as well.
And it's also available on the website. I believe it's also on the back of your WHA card.
Yes, it is. Yes, it is. So thank you for that. Now, we do have a question about out of country care. So what happens if we are out of the country and we need care?
Okay. So Western Health Advantage covers you worldwide. So when you're out of the country, if you have an urgent event, so you go to what we know as an urgent care center wherever you are across the world, and we can't control that other entity from asking you to pay the bill. So if you pay the bill, you hold on to that receipt, and when you get back into the service area, here at the dedicated service area, you contact Western Health and say, I had this urgent event, I paid X amount, here's my bill, and Western Health will reimburse you minus any applicable copayments that you have for urgent care under your plan. And it also does work that way similarly for emergency care at the hospital. Now, I realize emergency hospital care is much more expensive. That's why it's even more important to have someone on your behalf contact Western Health Advantage so we can be involved in that care that you're receiving, especially if it's going beyond just walking in and being treated and then going back to wherever you're staying. We will be having an upcoming Let's Talk webinar on Western Health Assist America program. Assist America is a travel assistance program. It's not insurance. So when you are traveling and domestically and internationally, anytime you're 100 miles away or more from your home address and you have an urgent emergent event, you can call upon Assist America to help direct your care. So more to come on that. In all full transparency, we did not include it in this month's presentations just because of the travel restrictions we're experiencing in the world right now. We thought it would be much more beneficial once the world starts opening up a little bit to then be excited about traveling, and we can share more on the Assist America benefit. But so please know, though, I think the takeaway is you are covered minus any applicable co-payments for either urgent or emergent care.
Thank you for that. Okay, and somebody is asking for the Teladoc phone number. That can be located on our website as well, correct?
Yes, and I have in front of me. So I'm going to give the web address. It's mywa.org/Teladoc. I apologize, I don't have that phone number in front of me.
So mywa.org //Teladoc. Okay, I just put that in the chat box as well if you guys want to jot that down. Our next question is, what is a disease management nurse?
Oh, okay, that's good, thank you. So Western Health has a disease management programs, and they're through Optum Health. So if someone is living with asthma, coronary artery disease, or diabetes, we have programs that these folks may qualify for to participate to help control these chronic conditions. So through Optum, these disease management nurses would help you in the program. So typically you can participate in, how you participate in these programs, your doctor can suggest that you participate and maybe submit your name to Optum Health. For that, you can request to participate, and it's just to help you manage and maybe make improvements in your lifestyle to help you with your chronic conditions.
Terrific.
And I have a phone
Thank
number
you.
for that if someone's interested.
I'm interested. What is that?
877-793-3655.
Great, and that is to the disease management nurse, correct?
Disease management program. So
okay.
You would call that phone number if you have one of those conditions that I mentioned, and to see if you qualify to participate in the program. You can also go to mywa.org/DM for disease management and complete the online referral form if you think that you would benefit from one of these programs.
And we appreciate all of you for becoming members with Western Health and want to thank you for choosing us. We hope that these webinars have been helpful for all of you to really understand your benefits. You know, I know we all get our benefits each year, but you know, who has time to really go through them? So thank you for taking the time to learn about yours and the value it may bring to your well-being. And if you missed it, let's see, we've got a recap of our first webinar. Is that right, Michelle? It will be a recap of our first webinar, which was how to get started. Actually, yeah, getting started with Western Health. It'll go over some of just the intricate details of how to get your login going, how to establish yourself. We'll be recapping that and summarizing it on Thursday, the 4th at 10 o'clock. So if you've already attended that, don't feel you need to, don't worry. But if you think you missed something, would like to get some more out of that, or haven't attended it, please sign up and register for that on February 4th. Okay, so we have, will seminars be online? Coming very soon, yes. We have our recordings I'm sorry?
Oh, sorry, just to add to that, Denise, we will be posting those online. It's just taking a little bit longer than expected. We're just dealing with some IT side things. But once they are ready to post and everything, I believe Denise, we're going to email basically everyone who registered, correct?
That is correct. Thank you. Thank you, Raymond. We're getting closer. Unfortunately, one of them we had some issues with, but we're going to try to re-record that. I think it was our second webinar. So the technical challenges of 2020 are drifting over to 2021, but we're getting a better handle on it. So that's great. Okay. Well, let's see. We've got another question here. How do I change doctors? Well, you call member services and they can assist you with that. Is that correct, Michelle? Is there any other steps? You can call the number right here on your screen.
Yeah, that's a way, or online through your member portal. But probably right. It's just as easy to call too. Either way. Oh, I would like to add. So I would like to add, when you do make a primary care change, thank you for asking this question, they're effective the first of the month. So if I call today, February 2nd, and I want a change in my primary care physician, it'll be effective March 1st. Unlike some other health plans, Western Health does not put a limit on the number of times you can change. I know one health plan, at least I heard, used to limit your ability to change your providers to a couple times a year. We hope that you never have to change your provider more than a couple times. However, we do give you the opportunity to change your primary care physician every month if need be. And if you ever felt you were in that situation, please reach out to us so we can help you find someone. Excuse me, find someone that you can work well with. But yes, so it's effective the first of the month. Even if you call on the last day of the month, if I called on February 28th, I could still have my new doctor March 1st.
That's great. Now, it might not show in the system for a day or two, though, right? Or is it instant?
Oh, it takes, the system takes, I used to take 24 hours to update, but now I think it's 4.
Oh, 4 hours. That's awesome. Thank you. If any of you did not receive the welcome brochure we sent out to all of our members, just let me know and I can email you a PDF copy of that, or we can surely mail another one out to you. I had someone call and ask for that. And we'll go ahead. So I think we're going to go ahead and conclude our meeting. Thank you again so much for being with us. We really appreciate all of you and hope that this was informational and useful for you in accessing care for your primary care provider and learn something new today. I know I did a couple things, so thank you again for your time. Have a nice day, everyone. Take care.